Alex Patel is here. He is one of our listeners. He is also a critical care physician here in Toronto at a local hospital. Alex, thank you very much for joining us. Can you just sort of give us a sense of what the last 24 hours has been like for you, and has it dramatically increased in terms of the awareness, the concern, as compared to the past week, for example?
Well, for us, it's been like this probably for the better part of the last week.
Okay.
We knew once things started to ramp up in Italy that we were inevitably going to see an increase in caseload here. Today, we get sort of updates twice a day and 2 calls a day about what's going on. This morning there were, in Ontario, 17 new cases, which is the highest that we've had. So that's, been the cause of alarm. Obviously, there's been background chatter about all the events being canceled and everything. But I would say there's been, a heightened sense of awareness for a while about this, and we've been doing preparation, and I wouldn't say the last 24 hours has really changed much, other than sort of I think made more people around us aware of what's going on.
What would you say would be an appropriate level of concern right now from the public, and do you feel like we are getting there? Do you feel like there's still a great deal of people that aren't taking this as seriously as they should be? Or are we taking it too seriously?
Yeah, that's a great question. I think most people are taking it, somewhat seriously now for sure, and perhaps even erring a little bit on the side of extreme. A lot of this depends on where you live. So obviously, if you live in Europe, particularly Italy, it's a huge issue, and they're doing their best to isolate everyone. If you live in North America and you're not in one of the areas where we have increasing spread, especially within the community, which means spread from people to other people, and we don't know how they got it. And the main areas that's occurring in is Washington, the Bay Area, and there's a case in BC. In those areas, there's definitely a heightened sense of vigilance. Everywhere else, we're not in outbreak mode. In fact, if you look at the way we're classified in Toronto and in most of the cities in the U.S., we're classified into low outbreak mode, which means we're not recommending, people isolate themselves or bunker down. We're recommending at this point, good hand hygiene, as you guys have said many times on your show, making sure you try not to touch your hands to your face, avoiding, high-risk situations like large group settings, large congregations, places where you're touching a lot of people, and that's all called part of social distancing, trying to maintain, a boundary of about a meter from people you don't know, and of course, if you're sick or you've traveled, isolating yourself from people. So that's kind of where we're at. It shouldn't really at this point in these areas be interfering with your day-to-day life. You should still be able to go, to most places you usually go to. Just have to exercise some common sense around high-risk areas and if you're ill.
We've been talking a lot on the show about, WWE potentially canceling WrestleMania, and maybe just even sporting events at large all around the world being canceled. What is your opinion about, first of all, WWE WrestleMania in particular, but also other sporting events all around the world?
So I think WWE WrestleMania is quite a problem for 2 reasons. Number one is just the number of people it attracts. So you take your traditional sort of NBA game and you've got 20,000 fans. WWE is going to attract much more than that, and it's going to attract a lot of travelers. The problem with that is you're going to get people coming in there that are traveling, and we know that a lot of the time, they're not necessarily bringing the virus from where they are, but they're picking up at the airport, they're picking it up on the airplanes, and you're getting a lot of people coming into an area where they could certainly have the virus, and then we know that they can start to show symptoms within about 5 days on average. So if they pick it up, they attend a few, pre-wrestling events, they're there, they attend a couple of, they could certainly get symptomatic on that trip, and it can be spread, in and around WrestleMania. They can also take that back home, and maybe they're in a country where they don't have a lot of cases, and now you're introducing it there as well. On top of that, you start to get this concept of community spread where things are being spread without us knowing. And when that happens, when we can't link specific cases to a traveler, that's really when we start to see an escalation in cases. And that's when we get really concerned from an epidemiology standpoint that we're going to see increasing cases and that we're going to start to really have to take aggressive measures. And an event like WrestleMania is a perfect breeding ground for encouraging something like that. So I think it should be, with a heightened sense of awareness that it is quite a high-risk situation. Now, that being said, Tampa is not necessarily at this point an endemic area. It's not the same as if it was in Washington, but that may change in a week, and we already know there are some cases there, and we know that majority of this is not just Tampa Bay people, it's people traveling in. So I would say it's more high risk than most NBA and NHL games and most of the other things you're seeing canceled.
Are there any common misconceptions that you're seeing on a routine basis? Anything that you're seeing as kind of like a pattern of, whether it be just misinformation or just, confusion that is naturally going to come out of a situation like this?
Yeah, I mean, I think I can address a few of those. The first one is around, what is social distancing and what does it mean, and do I not hang out with my friends? And that's not what it means. Social distancing means avoiding things like high-risk situations in large group settings, not, excessive contact with people. If you're sick, then staying home. If you travel, staying away from people. And generally speaking, if you're hanging out with people that you do know and everyone is well, that's not violating social distancing. I think the other thing is generally speaking, around how dangerous the virus is. So we know that 80% of people who get the virus will not be hospitalized. In fact, in Ontario, we've had about 59 cases, and no one has been hospitalized really yet for it. We know most people will go home and they will be okay. We know 15% will end up in hospital, and 5% will actually come to the ICU, and those are the ones that, obviously I'm most focused on. But we know that most of those are going to be those with, chronic health illnesses and those that are elderly. So I think it's important to exercise more caution around that. And the other thing is people are just a lot of hysteria about how this is spread. It's spread through what we call droplet, which means that droplets from someone's mouth have to end up either onto you because they directly cough on you, or they have to end up on a surface that you touch and then sort of touch your mouth. And we know, based on some data out of France, that's about 3 hours that the virus can be live on things. It's not because you get a package from China and you open it up. It's not because, somebody touched something 2 days ago and you're worried about it. So, if you're in a situation where you are touching things that people may be around, it's good to make sure that you either wipe it down or exercise good hand hygiene and wash it. And, maintaining some distance around people is okay. But just because somebody in the same room as you even has this, as long as, if they were, far away from you, they're very unlikely to transmit it to you. It's not an airborne type disease.
Are there any specifics you can impart on people that naturally there's going to be some level of paranoia? If I start to get a cough or a runny nose, that I'm immediately going to assume the worst, and we don't want to overcrowd hospitals such as the one you're working at. Is there anything you can inform people of things to be looking for, or is it, it's not necessarily you can self-diagnose yourself, obviously?
So the main thing is if you're in an area where it's not endemic yet, then usually you need a link. So a link to either have traveled yourself or a close contact who's traveled. So obviously if you have that will increase the risk that this is COVID. In terms of symptoms, the predominant symptom that we can isolate is fever. And we know that typically it's about 5 days after you've been exposed, and fever occurs in most people. If you have a fever, the other symptoms in descending order are cough and shortness of breath. Now, obviously, those have a lot of mimicry with diseases such as influenza, the common flu, and other respiratory illnesses. Some clues that it may be one of the others: a runny nose, typically associated more with the common flu, not so much with COVID. Headache is more with influenza, again, not so much with COVID. To give you a sense, though, we've swabbed in Ontario something like 3,000 people, and 59 of them. So 3,000 people we thought maybe had it, and 59 have had it.
Okay.
So that means, over 2,800 or 2,900 have had something else. And generally speaking, it's influenza or RSV, which is like the common cold. So those, on the whole, are much, much more common. If you have a bit of a sniffly nose and you don't have a fever and you have a bit of a cough and a little bit of congestion and you haven't had any link with somebody who's traveled and you're not in like Washington, D.C. or an area where it's really spreading, you probably don't have COVID almost certainly. And, you don't need to necessarily run to your local ER. We are actually setting up COVID centers. We just had a meeting about that around the city. That should be coming out in the news soon. One of them is being set up near where I work, where you can go in and get tested for COVID, and it's simply people who may have that. So that's a good spot to go if for some reason you think there is a travel link or your symptoms fit more with that. Otherwise, for the vast majority of people who have a little bit of an illness, we still advise that you stay home, but you probably don't have COVID.
What can you educate us maybe what the latest is on the I guess how contagious this is for first of all pets, but also for children, because I've heard conflicting things about both of those things.
Right. So the virus is what we call a beta coronavirus. So the best it mimics is SARS, if you guys remember SARS from 2003. What we do know about it is that it's more contagious than SARS. So SARS was spread not as aggressively, but SARS was much more fatal. The fatality rate in SARS was about 20%. This one is much less. It's closer to 2 to 5%, but it does spread more aggressively. Now, in terms of children, what we do know is that it rarely affects children. It can, and when it does, it's almost certainly never going to be lethal. lethal. No one under the age of 10 has died from this, as best we know. So in general, it's not a disease of young people. Kids can get it. There was a case in Ontario, but it's very rare that they get it. Even if they do, they usually recover. Predominantly, the ones that get sick are the older and the elderly, which is a little bit different than SARS, where we saw even young people getting very sick with this. So that's kind of the pattern of how it affects young people versus older people.
In your opinion, seeing how reportedly numbers in China are de-escalating, maybe even flatlining at the moment, has at least a portion of the world figured out a solution to combat this that others can replicate?
Yeah, I mean, it's very encouraging. So the number one thing you're going to hear about if you read a lot online or you hear things is something called flattening the curve. And what flattening the curve means is we know that if the whole population gets exposed at once, that the caseload will be astronomically high. The virus won't last very long because everybody gets it right away, but you're going to overwhelm hospitals and things like that. And that's kind of what's happening in Italy. That's why you see these sort of parabolic or quite increases that are occurring daily. In China, in Korea, in Japan, they've done a good job of trying to flatten that. So the way they did that was using social isolation or social distancing from people, as well as isolating travelers, making sure people stay home when they're sick. And by doing that, what they've done is reduce the caseload to the point that they're spreading it out a bit longer, but it's less total cases overall, and it's less at one time. So they're not overloading the medical system. And in fact, we are seeing in China, there were only, I think, 12 new cases today. We're seeing Korea come down nicely. We're seeing Japan level off. So we know that based on that, if you do good sort of epidemiology type things to prevent spread, you can level it out and it will come down. In terms of specific treatment for this, it is not a bacteria, so antibiotics are not effective. There are antivirals that are given. Typically, there are two that we use, and they are HIV antivirals, so medications that we would have used for HIV that we can use for this. Usually, we reserve those for sicker patients that are admitted to hospital. For the vast majority, they don't need any treatment. They'll recover on their own.
In terms of Ontario, how would you kind of assess how prepared the hospitals have been for this high volume as well? And is there any link to the SARS outbreak, having gone through this in 2003, that's made this province at least more equipped, or is there no real connection there?
No, there's definitely a connection. We're very equipped. We've been on the ball in terms of getting this going for the last while, even before we had many cases here. So we've, to give you an idea, already ramped up in our hospital and around hospitals ICU coverage. We've all created backup schedules. We all haven't been traveling, the physicians, that is. And we've done a great job of making sure that we have these centers up and running to screen people right away. So there is a heightened sense here of preparedness. And we know from SARS that a lot of the spread in SARS, the secondary spread, was at a hospital in the GTA where it got spread to healthcare workers and out. So, we've been doing a great job here making sure we have enough masks for people, that we have the proper training. We're going through mock exercises. So we don't anticipate. In fact, we have not seen a lot of what we call nosocomial or healthcare-related spread with this. So in Ontario, at least, we are very prepared. And we don't think this is going to overwhelm the medical system if people do a good job of staying home when they're sick and not getting the caseload up right away. If it does what's done in a lot of the other countries where it sort of spreads out over time, we can certainly accommodate most people, and we think we'll be okay. So SARS has definitely helped in that, but I think in general, just everyone here is taking it very seriously and is very prepared.
Do you believe that same precautions are being taken place in the rest of North America? And we heard the president speak on national TV about some of the restrictions that they're implementing as far as travel. Are you happy with how, let's say, the American or even the Canadian governments have dealt with this thus far?
I would have liked to have seen a better response. I heard Doug Ford today talking about how he felt people could just, from March break, come back, and I think that that's sort of the wrong idea to take. I think we know if you travel, it's high risk, and I think even if you travel and you're not sick right away, we know the disease may not come out for 5 days, so I think everyone should be isolated when they come back if they've traveled right now. We know that travel is a high risk, and I think, we should be doing that. So I would have liked to have seen a stronger statement on that, and I know, most of my colleagues and us have drafted a letter to sort of send to the government that we're in the process of doing. I think in Italy, they didn't do a great job of taking it seriously initially, and we sort of saw the effects of that, and it's hard to catch up when you don't do that. In parts of the U.S., they've They have a bit of a problem as well because of the way that their system works. I don't know whether everyone there can seek out care for free like you can here. So there is that impetus sometimes not to do that. So I think that does limit their ability to get everybody who is screened right away and isolated as much as we can here. I think overall, though, I think most people are coming around. I think, in areas where it's starting to spread more like Washington and California, they've shut down most things. They've limited gatherings. They're really trying to keep the caseload low. The United States is following more of an Italy pattern in their initial curve, more so than Canada is. So they are seeing an escalation in cases. And, I don't know. We don't know the exact reason. It could be because access to health care. It could be because, they just have more people. And because of that, you're going to have more travelers. But, I think it's a step in the right direction. I think Trump took it much more seriously now, obviously, than he was before. Just banning travelers, though, isn't from one part of the world is not going to solve the problem. We have to be smart about how we treat anyone who travels and anyone who's sick right now.
Anything we haven't covered, Alex, that you maybe want to convey to people out there that maybe, obviously a significant amount of concern that's out there?
Yeah, I think I want to convey that, not to think the world is ending right now. By and large, you can do most of what you do. You just have to be smart about it. So if you're sick, stay home. If you've traveled, stay home until you've had an appropriate amount of time. If you have elderly parents or you have people on immunosuppressives that are high risk, don't go near them if you're sick. If you happen to have large congregations like a WrestleMania, for instance, it may not be popular to say, but I think you should avoid those right now because we know those are high-risk areas to spread. Don't go touching a lot of people without, making sure you wash your hands and things like that. And I think if you follow those general practices, at least until this, maybe becomes a community-borne disease where everyone has it, you can still go about most of your life, and you should. I don't think we're going to win anything by everyone, bunkering down, maybe as people are doing. So I think that's the message: is to take it seriously, to distance yourselves from people as you can. Make sure that you're isolating yourself if you're sick or traveled, but doing the things that you can otherwise do to live your life.
Alex, thank you so much for all of the information, as well as on the forum as well. I know I speak for everyone. They are very grateful for all the information you've been able to impart.
No problem. I'm happy to help anytime I can.
All right.